Assalamualaikum viewers, Dr. Ali Thalho welcomes you in program, and we will discuss today regarding the notification issued by the DRAP, the Drug Regulatory Authority of the Pakistan, to notify that the doctors cannot prescribe the medicine with a trade name, and they have to write the generic name. So this is under the allegation that doctors have some under-table deals with the pharmaceutical companies. And this is not only the question of the reputation and the credibility of the doctors, but it is also that if the doctors cannot prescribe the medicine with a trade name, that's who will then deliver the medicine to patients. We will discuss on this topic, and that's we have of the medical experts and medical practitioners. We will like their views on this topic, and that's so let's start. Dr. Nisar, that's welcome to join us. That's in our discussion. As you know, that's the DRAP has notified that the doctors, they cannot now prescribe the medicine with a trade name. So I would like your comments on the notification.
Dr. Ali, I am thankful for raise such important issue. I think DRAP decision is correct, but there is some issues regarding prescription of medicine with generic name, but impossible to implement in this country because there is a lot of pharmaceutical companies same generic with different trade name. So when any doctor prescribe this medicine with a generic, who will take the decision and quality of medicine given to the pharmacist from pharmacy or pharmacist? So what do you think? There is more honest pharmacist than the doctor?
That's I would like to ask you. That's in other countries of the world, there's such policies implemented, and doctors are not eligible to write their trade names. They are prescribing the medicine with generic names. So do you think that such policy is implementable in Pakistan, and if not, then what are the reasons behind?
Well, Dr. Ali, you are right. Prescribing generic already implemented in many developed countries. You know, in those countries such as Pakistan, check and balance of pharmaceutical companies very poor in Pakistan. So it is impossible in our country that we implement this in our country.
Now we have this one other doctor with us, that he is the MPhil in pharmacology, Dr. Nadeem Akhtar Kurai, and he is the diabetologist and he is a medical practitioner. I would like Dr. Nadeem Kurai to give his comments on the notification that doctors are banned to prescribe the medicine with a trade name.
Yes, thank you very much, Dr. Thalho, for asking me this question. Yes, this may be a right decision, but the effects of the decision will be more on the pharmaceutical industry than the doctor. And second, how the government will implement this decision. I think it will be a failure, like government is not even to control the quackery, and you see unqualified practitioners are spread all over the country, and nobody can control this menace.
And I would like also your comments that such a decision has been announced. I think this is without any homework, and a lot of the things I think that we need to implement first. That's we have the substandard drugs in the market. We don't have the vigilance properly, and the drug authority is not properly working, and the doctors community is not feeling good and have grievances. That's why this type of the notification has been issued.
Yes, you are right. All you see, all the fingers are not equal. You cannot say that every doctor is prescribing medicines on the after taking a commission from the pharmaceutical industry. Yes, but few doctors may be involved, and I think the qualified and quality doctors are not prescribing these things.
That in last, I will be thankful that if you will reply that what do you think about the role of the Drug Regulatory Authority of the Pakistan? Because I don't think that they have succeeded to control the quality of the medicine, and there are a lot of the things which I think that's what the responsibility of the drug authority, but they have failed. And we have seen that's more than 500 pharmaceutical companies over here in Pakistan running without any vigilance, without any quality controls, working in a small home or places.
Yes, as I said earlier, this is very difficult to implement because we have not up to date healthcare system, and we have not tight check and balance system. So, and everywhere there's the bribery. So government may face tough challenges to implement this decision.
If a medical experts or the highly educated peoples cannot prescribe the medicine, so now it will be the choice of the medical storekeeper or the pharmacist to give the medicine with his own choice to the patients. And the same question will arise again, that's who will give this assurance that the pharmaceutical companies who were offering to the doctors for on the basis of commission to prescribe their medicine, they will not offer to the medical storekeepers and the pharmacists. So this is a question, and we have to think about that. So we will continue this our discussion in our next programs. Till that, I will say you bye, to meet you soon. Allah Hafiz.